Hey guys, I'm Dr. Jesse Riley, owner and main doctor of Modern Movement Clinic here in the Denver Golden area. Just wanted to stop in and do a real quick video on basically how you can mechanically diagnose and test and retest for your neck pain, okay? It's a really easy way of trying to see improvements if we have some limitation in our range of motion, okay? Notably, what I'm going to be talking about is more in rotation and lateral flexion, okay? What I typically notice with people is when they come in with neck pain, there's usually a limitation either in rotation or lateral flexion with either pain or non-pain, but we're trying to clean that up because sometimes that can lead to other issues with the neck. So one way to do this is I usually have you guys check your own rotation. So turn your head to the right for me. So I'm going to look directly to my right, and I'm just going to note if there's any pain on that side or not, or on the other side, either way. And I'll do the same thing with the left. And then I'll make a note of that, okay? I may feel like it's harder to turn one direction too, whether there's pain or not pain. The next thing I'm going to have us do is we're going to take our ear, our right ear, and tilt it towards our right shoulder, like so. Okay? You can kind of notice like I'm trying to keep my head focused towards the camera. Some people tend to try to rotate their head that way. I want you to go ear straight to the shoulder, and then we'll do the same thing on this side. So I notice that I have a little bit harder time going this way, but there's not necessarily pain with it, okay? It just feels stiffer. So here's where the mechanical movement can come into play, and we can retest, okay? So what I'm gonna do is I don't have any pain this way, but I do feel limitation. And so you always wanna go first to the side of no pain. So what I'm gonna do is I'm gonna take my hand and I'm gonna put that into my lap, right where my hip crease is. I'm going to push up so that my shoulder comes up. I'm not gonna shrug up, I'm gonna push up, okay, with my hand. And you kind of notice my shoulder just stays up there. I'm gonna take my left ear again and I'm gonna tilt it towards my left shoulder. I'm gonna take my left hand and pull just slightly that direction. You may get a little bit of a stretch on that right side, but we don't want to overstretch either. And so I'm going to repeat that 10 times. Okay. Let's just say that I did that 10 times. And so what I'm going to do next is I'm going to kind of retest the movement, okay? So I'm just going to take my left ear to my left shoulder, and I have far less stiffness on that side as a result. You may notice this with rotation as well, okay? Start with that one. Another one that we can do is we can do what's called chin retractions, okay? So what that is the cue that I give people is I want you to think someone, let's just say someone kind of gross is coming in to try to kiss you. And what do we tend to do? Take our head back, right? I'll show you from the side here. It looks like this. Okay? So, gross person coming in, retracting my chin, okay? I'm not gonna be tilting my head or anything, it's just straight back, like you're trying to make a double chin. So that's another movement we can do, where we can do 10 times, okay? So, and then you would repeat the same process, okay? So now I feel like even turning to the left, like I have a lot more range going this way. It feels a lot looser. So I'm gonna have to hit a few on my right as well to kind of help open up that mobility. But you guys give it a shot. Again, test your range of motion first. You wanna go to the non-side of pain first. And as long as there's no extreme pain with going to the direction of pain, hey, if that helps, great. But again, you don't want to go too far into either direction and overstretch, because sometimes that can tick off the nervous system. All right, but test your range of motion, find your limitation, do your reset, and then retest the range of motion. Okay.